Hello and welcome to all. Thank you so much for being with us today. My name is Laura Durso, and I'm the Executive Director and Chief Learning Officer of the Whitman-Walker Institute. The Institute was created to build on Whitman-Walker's 4+ decades of experience providing care, particularly to LGBTQ people and people living with HIV, and expand our service to the DC community through strategic integration of research, policy, and education. We're here today on the International Day to End Violence Against Sex Workers to release our new report, Improving Laws and Policies to Protect Sex Workers and Promote Health and Wellbeing, alongside our incredible colleagues at HIPS and the O'Neill Institute. This multidimensional research project is emblematic of the approach the Institute takes to conduct and disseminate high-quality research and policy analysis in partnership with issue experts and organizational leaders, and informed by the real-world needs of our community members. It reflects our enduring commitment to the health of DC's LGBTQ community and would not be possible without the efforts of the advocates and researchers who came before us and those who are here with us today. We wish to extend a special thank you to the Elton John AIDS Foundation, who provided support for this project. This report came about because of a very real need. In the 2015 DC Trans Needs Assessment, a survey of transgender people conducted by the DC Trans Coalition, over 1/3 of respondents reported engaging in sex work in the past, and transgender women and transgender people of color were more likely to have a history of sex work than other transgender people. And while each of us deserves to be safe in our community, regardless of the kind of work we do or the reasons we do it, our research demonstrates yet again that the criminalization of sex work continues to push people to the margins and trap people in cycles of victimization and poverty. As one of our focus group participants stated, quote, "The impact of arrests is you lose everything. When I came home, I lost everything, family, money, whatever clothes I had to start all over." This report covers how these issues have negative impacts on sex workers' mental and physical health and block access to the employment, housing, and healthcare supports the district has created to serve our community. Another of our participants spoke of the lack of accountability for the discrimination and mistreatment sex workers experience, leaving individuals without the same level of protection as other members of our community. This lack of accountability, quote, "makes us not want to go to the police at all and not want to even call the police. What am I going to do if I feel like I can't trust the police and I have to do what I have to do?" The report recommends several policy changes that should be implemented to ensure the health and safety of sex workers in DC, including decriminalization of sex work and increasing affordable housing stock. And we hope that it will spur further examination of how the law can create safety and security or can inhibit our ability to build a city that is safe for all. Before I pass the mic, I want to take a moment to introduce and thank our panelists who have joined us today. We extend a welcome to our moderator for today's discussion, ANC Commissioner-elect Mahana Mohammed, Chair of the Board of Directors of the DC Center for the LGBT Community. We are honored to have Tamika Spellman, the Advocacy Director at HIPS, joining us, and also the co-authors of the report, Benjamin Brooks, the Assistant Director of Policy for the Whitman-Walker Institute, and Sean Bland, Senior Associate at the O'Neill Institute for National and Global Health Law. Thank you to all of you for joining us. And it's now my pleasure to introduce Jeffrey Crowley, Director of Infectious Disease Initiatives at O'Neill Institute, to join me in our opening. Welcome, Jeff.
Great, thank you, Laura. And it's a pleasure to be with all of you today. So I first want to just acknowledge Sean Bland, who works with me. It's a pleasure to work with him every day. He works hard on everything he does, but this project was a special passion for him. I also just want to acknowledge our great partners, the Whitman-Walker Institute and HIPS. You know, our three organizations are very different, and I think this is the kind of collaboration that just shows our differences really were a strength. And I hope everybody is pleased with the report that's being released today. Last year, the Trump administration launched what's called the Ending the HIV Epidemic, or EHE initiative, and they boldly asserted that the United States can reduce the number of new HIV transmissions by 90% by 2030. This is a bold goal. It's going to take a lot of work. Now, the first phase of this plan involves focusing on 48 US counties out of more than 3,000 that are responsible for more than half of all HIV transmissions in the United States, as well as the District of Columbia, San Juan, Puerto Rico, and 7 rural states. So HIV remains a very critical health issue for the District of Columbia and this region. So it's really important that we keep our focus in our community and take strategic actions to make a difference. Now, prior to joining the O'Neill Institute, I served for 3 years as President Obama's HIV/AIDS advisor. So from 2009 to 2011, I was the director of the White House Office of National AIDS Policy. And from that role and continuing at O'Neill, I think a lot about how we end the HIV epidemic. And I also think about once we've ended the epidemic, what's the story going to be that we're going to tell? And I think part of that story is how we fought for marginalized communities and demanded respect and dignity for all parts of our communities. You know, at the beginning of the HIV epidemic, we talked about the 4 H's. There were Haitians, homosexuals, hemophiliacs, and heroin users. And so we baked stigmatization into our response to HIV from the very beginning. Just thinking about that highlights that we need to continue to fight for all parts of our community. Now, at the beginning of the epidemic in 1981, I was 16 years old and just realizing I was gay, and going from there to where we're at today, it's hard to believe the progress we've made. I think of it, there was a commercial running, I think it's for Etsy now, with a young couple, young Black gay men celebrating Christmas with their family. That was unimaginable when I was 16 in 1981. And so in some respects, we've made major progress, but we also know the progress has been unequal. There are parts of our community that continue to be marginalized, stigmatized, including trans people, people who use drugs, and people who engage in sex work. So we have a lot to do to keep bringing forth all parts of our community. Earlier this week, I read a story about Congresswoman Ocasio-Cortez. She was in the news, and the headline was, she said that sex work is work. Now, this was apparently outrageous. And the story was about an EMT worker in New York that was engaging in some side work. They opened an OnlyFans site, and it was really about they needed more income, and this was how they did it. But when you looked at what the outrage was all about, or the faux outrage, and Congresswoman Ocasio-Cortez's remarks, she really framed it as it's about the steps you take for economic security. It's about dignity. And I think we need to all remember those kinds of challenges. It's also, interesting that essentially we're trying to shame people for being poor, or this economic shaming. And I think back to something else I just read about this week. In the news, Kris Jenner was the first American to get a Rolls-Royce Ghost, a car that cost $330,000. We also know that we're facing an existential crisis with climate change, but too many people still have private jets. So if we're going to shame anybody, we shouldn't shame the poorest. And I just think this for me raises a question if we have our priorities right as a country. So even when we talk about people that engage in sex work, I think there's automatically this sense that we need to see it as shameful, and I think we need to move beyond that. Now, I think that this report is going to show us how we can make progress. And a major way that we can make progress is addressing what are called the social determinants of health. Laws and policies matter. Economic security matters. Employment discrimination. We need to create safe communities. We need to work for affordable housing. We need to respond to trauma. And if we do those kinds of things, we can improve the health and well-being of people who engage in sex work. Now, this is an easy message, but I don't want to pretend that it's simple. I know some people are very worried about trafficking and exploitation, and those are very real issues, and they demand important responses. But they're separate from sex work, and we believe that we can deal with these tough issues by respecting the dignity and protecting the rights of people who engage in sex work. So I think we're going to have a rich discussion today, and I think it's a great report we're releasing. And so I'm just proud that we're part of this collaboration. And now I'd like to introduce Tamika Spellman, who again is the Policy and Advocacy Director at HIPS. Tamika?
Hi, my name is Tamika Spellman, and I'm here to recant my own experiences as a sex worker for 38 years. And just listening to Jeffrey's testimony, it tells me that we had some of the same type of experiences, because I was young. I'm 53, soon to be 54. And when I came out, there weren't very many protections for people like me, and especially being a sex worker. I remember how negatively I was affected by the policing of sex workers. They seem to take more so advantage of me being a trans woman than they did of the cis counterparts. You know, there were many times that I would be dressed in black so that I would hide from the police because of the things that they were doing to me. And, you know, it was affecting me overall. It had a negative effect on me at the time when it came to my drug usage. You know, I was a former hard drug user, and it exasperated it. The arrest that happened to me, I lost my car. I lost my motel room. I lost my medication. And it takes time to be able to get back ID, to be able to get your car and your life back. And this is something that has continued over the 38 years that I have been a sex worker. And this is not just my story. This is the story of sex workers all across this city. And not just across this city, this is nationwide. This is an issue all across this country. That is why we're calling for the decriminalization of sex work, so that I can be freed from the system that is actually controlling my body from what is essentially having casual sex. This is nothing but casual sex taken to a next level. And because of me being who I am, Black, transgender, I have been stigmatized and I have been abused by authority. And a lot of times this is what bars us from being able to stay in treatment, for us to be able to move forward in life. I have a degree, and this is the first time I've actually been able to work in a job that I could use my degree. And that's because of all of the arrests that I've had over my lifetime for doing sex work. They say that your record doesn't come into play when you fill out those job applications. That's a lie. And as long as I was stuck in doing low wage, minimum wage jobs, I ended up having to do sex work to make sure I could make ends meet. And then those jobs are just as bad as me being out here on the streets and what I go through with the police. But at least I made more money. And I was able to take care of not just myself, but my kids and my family. People are forgetting that we are human beings and we have family and friends that actually care about us. And it's not the care that you might think because they're worried about me being a sex worker. They're not worried about me as a sex worker. They're worried about my safety. And this is where people get things twisted. They think the police are safe. No, they're not. I wasn't safe when I was raped by the police. I'm not safe when the police are extorting money from me. That sounds like a trafficker, because other officers would pick me out of all of the girls. They knew that I would give in because I was looking at what's safest for me. And sometimes that meant doing what they wanted. But that is a cycle that we can change. Take us out of the hands and out of the reach of the law. Because it makes absolutely no sense to continue to be putting resources into policing me when you should be trying to uplift me instead of jailing me. My life shouldn't be based on how can this country keep me locked down. It should be based on how this country can help me to stand on my own 2 feet, to be a thriving and productive citizen. This is why I'm in this fight. This is why I talk so much about what goes on with sex workers and what sex workers are in need of. Because this has been my life. And honestly, I could walk away today. But then what kind of person would I be to leave the system as it is when I know how much harm it has brought to me for the ones that are coming in behind me, because it still exists. It has always existed. And it's time for us to come out of the margins and back into the light with the rest of society. There were times in our history here in this country and in this city that sex work was something that's celebrated. When it was back in the time when it was the Mae West of the world. And they were protected. Brothels were safe havens. But y'all look at that now as a problem for something that people do every day. That's my piece. I'm here for questions.
Thank you so much, Tamika. And thank you so much, Jeff and Laura, for starting us off. I think particularly, Tamika, your remarks, sharing your personal experience with sex work are so powerful and really is at the heart of why we're doing the work that we're doing to continue this fight for sex workers, moving toward decrim and moving towards protecting all the rights and the dignity of folks who engage in sex work. So thank you for sharing that. We're gonna move from kind of those opening remarks to a moderated panel discussion. So feel free for Laura and Jeff, if you need to drop off, that's fine. And Tamika's gonna stick around with myself and also Ben Brooks and Rayhana, who are here and who will be part of the panel discussion. My name is Sean Bland. I'm a senior associate at the O'Neill Institute. I'm also the principal investigator for this project, and I co-wrote the report. Our work would not have been possible without the support of the Elton John AIDS Foundation. I think all of our speakers have so far mentioned their support, which again is key to us being able to do this work. It also would not have been possible without the participation of sex workers in the District of Columbia who participated in our focus groups and who, like Tamika, shared their story, again, often very traumatic stories, very personal, with us and trusted us with them to include in our report. So again, we thank them for their involvement. Today, I'm going to moderate a discussion with our three panelists. We will have time for questions and answers, which you can type into our chat. So the chat feature is there where you can type questions in. We will get to as many questions as we can in the time that we have. Before we get to the panel discussion and before we get to your questions, I'm going to give a bit more background. And I also just want to tell you a little bit more about the work that went into the report and some of the findings of the report. So just in terms of background, I want to just make sure that we're all using terminology and having familiarity with the terminology that we're using. Sex work refers to the exchange of money, goods, or anything of value for sexual services. We use the term sex work in our report. We're using it today because that is the term that sex workers use. It reinforces the idea that sex work is work, and it really does allow for a greater discussion of rights, in particular labor rights and conditions. And this is an umbrella term as well that encompasses many different forms of sexual labor. So that includes street-based sex workers, folks who work online, so online-based sex workers, as well as sex workers who work in brothels or in other settings. Now, our report provides more background on this terminology and just background on the issue of sex work. Again, the link to the report is also in the chat feature. So please take a look at it now and obviously after today's report launch. Also, really a major focus of the report is how we need to change the laws around particularly the sex work criminal laws and other policies, especially policies that support access to housing and employment in order to better protect sex workers and improve health. The report discusses overlapping crises that sex workers are facing. So crises such as HIV, violence, and criminalization. And these issues are particularly challenges that our most vulnerable sex workers are facing. So particularly those who are Black or who identify as LGBTQ. So in the report, we have a call out box that specifically says we're leading with race. So race is a critical issue that needs to be thought about. If we're thinking about sex work and reforming laws and policies without thinking about the role that race is playing, we're not doing our jobs right because we're not protecting the most vulnerable. Similarly, if we're not centering the voices and the experiences of trans individuals, particularly trans women and Black trans women, and all LGBTQ folks, we're not doing our job. And so that is at the heart of our work. And hopefully you see that reflected throughout the report. Similarly, our report gives a lot of context. So it provides the current legal landscape in Washington, D.C., and it talks about how we got there. So you see a timeline that shows, from the very beginning of criminalization in the district to the present. And you see how policies have evolved and changed over time. So I hope you will read that and learn from that as well. So most of the report, however, describes our research project and the results of our project. And as a part of the project, we conducted 3 focus groups with 27 sex workers. These are people who reported engaging in sex work in DC in the past 2 years. All but one of the sex workers identified as Black, and 2/3 of them identified as transgender women. So again, we sought to center the voices of sex workers in our report, particularly those who are the most vulnerable, and I think that's reflected in the participants in our research study. We also conducted interviews with government officials, legal experts, sex worker advocates, and victim services providers. So a range of institutional stakeholders also contributed to the study. I just want to start with a few of the findings. A key finding was that DC prostitution laws are harmful, and they're also ineffective at stopping sex work. We know from talking to sex workers that sex workers engage in sex work for a variety of different reasons. Most people in our study cited the need to earn money, as well as to gain access to housing and other necessities as motivations for engaging in sex work. Many of these individuals, especially transgender individuals, noted difficulty finding housing and finding employment due to discrimination, so due to anti-trans discrimination. For them, sex work was and is survival. Still, others mention that sex work is work, and it's really the work that suits them best. So it just makes sense for their lives. So that is the reason why they engage in sex work. And all of our participants emphasized their own agency in doing sex work. And they didn't characterize themselves as victims of trafficking. So as Jeff mentioned, trafficking is an issue that needs to be addressed, but it is distinct from consensual sex work. And again, the focus of our report and the focus of our discussion today is going to be on sex work. Sex workers who participated in our research study dealt with a range of issues, particularly had a number of health concerns, so HIV and other sexually transmitted infections being chief among them, but also just the basics of safety. And sex workers experience violence from a range of people, including clients and potential clients. But a big takeaway was that the main concern that we heard was violence and abuse that they received from police. Transgender sex workers in particular reported being misgendered, harassed, and profiled by Metropolitan Police Department officers. Here's a statistic, because we also did a survey along with the focus group, so we asked everyone the same questions. 15% of sex worker participants in our study reported being victims of physical or sexual abuse at the hands of police in the past 2 years. And Black transgender sex workers were particularly subjected to abuse. Because of this abuse, sex workers lack trust in law enforcement and are often unwilling to report being victims of crimes to law enforcement. So for sex workers, the police are not sources of safety for them. In fact, it's the opposite. They are often victims of the police. So victims of violence, victims of extortion. And for the main message that was emphasized in all of our focus groups is that sex workers want to have as little interaction with law enforcement as possible. Why is that? Well, the very act of being arrested, even if one's arrested just for an overnight stay in jail, has very significant consequences for sex workers. Not only do they face violence and extortion and abuse from police, but they also face mistreatment from jail staff. And many noted that any time in jail was extremely disruptive for their lives and their ability to take care of themselves and take care of their health. For instance, participants noted that not being able to take medication when arrested. And we know that some medications, like HIV medications or pre-exposure prophylaxis, PrEP, need to be taken every day, and missing a dose means worse health. We also know that just the broader disruptive effect of going to jail, even for a short time, sends lives into chaos and makes it harder to make medical appointments and to take care of yourself. Being arrested and being convicted has also very serious consequences for accessing housing and employment, as Tamika mentioned. Once a person has a criminal record, they may be denied housing or employment, which traps them into cycles of poverty and homelessness. Learning all of this from our sex worker participants, we also asked them, what do they want to see in terms of changes to laws and policies? Unanimously, participants supported reforming sex work criminal laws in DC. They did not want to continue the status quo of criminalization. In particular, there was strong support for full decriminalization of sex work. That means removing criminal penalties for sex workers and for their clients. This was viewed as a better option, well, being better than partial decriminalization of sex work, where clients can still be criminalized, and also better than legalization of sex work, which involves various legal regulations. And again, all of these are topics that I look forward to discussing more with our panelists. So I want to introduce each of our panelists. We have Benjamin Brooks from the Whitman-Walker Institute. We have Tamika Spellman continuing to join us from HIPS, and we have Rehana Mohammed from the DC Center for the LGBT Community. I'll let each of the presenters also share a little bit more about their background when they speak, but I'm going to start with the first question, and that question will be for Ben. Ben, what did you learn when preparing this report? And maybe you could share some of the findings from our interviews with institutional stakeholders to give us a broader sense of where there's agreement with what we heard from sex workers. And if you could also just tell us a little bit more about some of the key recommendations from the report.
Thanks, Sean. Thank you for that background, and thank you for the very broad and open-ended question. I appreciate that. I want to sort of relate as well that for this work, the context of DC was very important, that our results in our research are really hyper-local. And so I emphasize that because we have built this research on the research done by the Move Along report and the Access Denied report in 2018 and 2015. And the Move Along report itself recommended this exact kind of citywide consultation with sex workers and with institutional stakeholders. And so, as we always are in science and in the LGBTQ movement, we are standing on the shoulders of giants. And so I think some of them even might be here in the audience today. So thank you so much for your work. And thank you for sort of helping us understand the crisis that we are currently living in. The history of the response to DC's prostitution laws is really interesting. We see one of the key points of this report is to look at the range of responses over time. And so we see in the 1990s and the early 2000s, the MPD takes a real sort of prohibition stance on the issue and tries to eradicate the presence of sex work in public spaces. And what we found is that was met with activism and organizing by the trans community and by the community of sex workers to push back and create a safe and diverse DC. And so what we now see in the later years closer in 2019 and 2016 is repealing some of the more harmful and arguably unconstitutional laws like the prostitution-free zones. And including like last year, the mayor set up a working group to find alternatives to arrest and incarceration for prostitution offenses. And so the sort of movement towards a less punitive approach has been building, albeit a little slowly. And so what we found in our institutional stakeholder interviews is a large degree, like Sean noted, of consensus. Most of our institutional stakeholders in particular, including the government officials and the human services and victim services providers, find that the criminalization creates barriers to accessing the city's resources. It's interesting that we say that sex workers are marginalized, and what our reports find is that the law itself creates the line that sort of creates the margin. And so if we say that sex workers are pushed to the margins, we find in our report that the MPD and the DC Council are the bodies that are doing the pushing, because the law is a function of our society. And so the reason we recommend decriminalization is because it acts to bring sex workers into the community and recognizes that they are an inherent and essential part of DC, and they always have been. And so we find as well, we did sort of a global review of the research on decriminalization and its effect on health and well-being. What the research finds is that there are 3 places in the world that have had the kind of impact on health and reductions in violence that we are looking for in DC. And those places were Rhode Island, New Zealand, and the city of Mysore in India. And so those 3 places were, Rhode Island is a little bit of an anomaly, so I'm going to set it aside, except to note that during a period of decriminalization, there were substantial decreases in rate and incidences of female gonorrhea in the whole community. So this is an excellent finding from a kind of natural experiment that occurred. And in New Zealand, the sex workers reported increased rates of condom usage and an improved ability to report violence to the local police. And then finally, in Mysore, India, in the Ashrodaya Samiti collective, the collectivist project found they were safer and healthier, also reporting increased condom usage and reductions in client and third-party violence. So in New Zealand and in Mysore, where the 2 places where the culture of stigma and criminalization was changed intentionally, the circumstances that we see there were activated, organized, and empowered sex workers. And that is part of what we have here in Washington, DC. And so our report, recognizing the sort of holistic political, medical, public health infrastructure that we have in place in Washington, DC, recommends first the total decriminalization of consensual commercial sexual exchange. We also recommend, in order to address the needs, the urgent needs of the community, we recommend increased access to affordable or public housing. We recommend as well, based on the needs of sex workers and transgender women in the community, that there be increased employment and education support for folks in that community. And finally, because the report finds that the sources of participation in sex work are often the discrimination in education and employment, that the city undertake further efforts to reduce and eliminate discrimination against LGBT and particularly transgender people in our community. So finally, I just want to note that our report really finds that stigma is one of the fundamental harms of this law, that the feeling that a person will be judged for the kind of work that they engage in and judged for their lifestyle is not a new experience for the LGBT community, but it continues to provide to create a barrier for people to talk openly and honestly with their healthcare providers and to access the medical care and the resources that they need to keep themselves healthy. This also has, of course, implications for behavioral health, for mental health, and for the city's economic well-being as we try to recover from this other global pandemic.
Thank you so much, Ben. It was an absolute pleasure to work with you to write this report, and thank you for that summary. So our next question will be for Rehana. So in addition to just introducing yourself a little bit to the audience, Rehana, I want to ask this question. do you consider the decriminalization of sex work to be an LGBTQ issue? Is it a racial justice issue? Why or why not?
Yeah, thank you so much for that. And thank you for having me today. Again, I'm Rahana Mohammed. I'm board chair at the DC Center for the LGBT community, but I'm also here as a DC resident. And I was recently elected to serve as ANC commissioner in SMD 2F07, which is in Logan Circle, Shaw area. So wearing a couple different hats, but I'm here to say that under all of those different hats, sex work and the decriminalization of sex work is a really important issue. Specifically, it is an LGBT issue. It is a racial justice issue. I'm also here as a Black woman who cares a lot about other Black women being respected and not criminalized in our community and in our city. And thank you so much, Tamika, for sharing your experience. And I know that that's an experience that many in our communities face. So you're hearing today one voice of many. And I know that this is many other perspectives and voices are captured in the report. It's a really important report. So thank you for doing that work. And, not only are LGBT people performing sex work and working as sex workers, but as you said at the top, we're also more subjected to violence at the hands of the police for doing sex work and more marginalized by the community already. So it's a critical LGBT issue. In addition, I wanted to, underline one of the things that Tamika shared earlier, which was that sex workers have not only always existed in our community, but have been celebrated in our community. And even some of the biggest leaders and heroes in our community, like Marsha P. Johnson and Sylvia Rivera, performed sex work, were sex workers. So it's not just that, sometimes I feel like we talk about this issue as, it's the responsibility to help those most marginalized, but it's not only that, it's also our responsibility to celebrate members of our community and recognize that they have value, not just in spite of the fact that they are sex workers, but because they are sex workers, and they're critical members of our community. And, one more thing I just want to say is that those of us pushing for, or in the LGBT community organizing, what we're aiming for is full liberation of our community. We're not aiming for just conforming or acceptance or things like that, right? We want our community to be fully liberated, able to show up as our full selves always and participate as equal members of our community. And that cannot happen while members of our community are being criminalized and victimized and, abused by a system intentionally because of how they earn their living. So that I'll step off my soapbox a little bit, but it's definitely an LGBT issue and a racial justice issue. And thank you all for doing this important work.
Thank you so much, Rehana, and thanks for joining us today. I want to ask one question for Tamika, and then I want to start getting into some of the questions from the audience because we have a number of them. Tamika, what misconceptions do people in the community at large have about sex work? And what is being done to engage and educate the public about sex work and the decriminalization of sex work?
One thing that I think that people have a misconception about of sex workers is that we're the dregs of society. And that's an absolute lie. A lot of us are very well educated, and this is where this disconnect comes. People feel like we're just a bunch of drug using, sex working heathens. I'm a Christian. I go to church. I haven't been this year, but that's because of COVID. But people look at us like we are just such nefarious people. I'm also a parent and a grandparent. And I've been a good parent to my children. And they're still a part of my life. And this is something that people, they feel like we can't raise kids, have productive lives, and do anything positive. I'm a leader in my community. People come to me with their life problems. And that's because they know that I've survived so much that I obviously bring something to the table. I didn't live for 53 years by mistake. You know, what I need people to be thinking about is, I always hearken back to my Christian upbringing. And we have to look at Jesus was an advocate, and he cavorted with the people that were these dregs of society that government looked down upon. Government has a role that they're supposed to be playing. What is this with this taxation without representation of the people? I am a representation of the people. They should be working their hardest to help. At no point in my life should I have had to suffer as much as I have. At no point in my life should I have had to work low-wage jobs this long when I have an education to have gotten a better job. It is time for people to stop putting all these barriers in place and keeping people back from growing and being them because they don't like something that they do. So a lot of people out here, I don't care for what they do. But that's their business. What I care about is, are you safe? Are you healthy? And are you thriving? This is where we get this twisted. Stay out of my bedroom. It's none of your business because I'm not coming into yours. But if you want to make sure I'm being healthy while I'm in there, sure, I'll accept that. Know what your place and your boundaries are. Learn how to be a good neighbor to someone instead of standing in their way of growth and prosperity. America's supposed to be the land of the milk and honey. Where's the milk and honey? Is it just for those that conform? Because I'm not a conformist. I'm different. And we're supposed to be celebrating differences. And because of my difference, that shouldn't make me suffer. We need to be looking at how we can be better neighbors and community members to one another. And standing by and watching violence happen to me, that's not cool. Because if I'm not safe, you ain't safe. This is where I work with people to usher in safety in my community that is not dial 911. Because when they're in the room, I don't feel safe. I would feel safe if the neighbors and the community members were out there holding me down. Because if something goes on in my neighborhood, you better believe I'm going out there and see what the hell going on because I'm a community member. I live here. I live right next door to a school. There were kids out there fighting. Don't know near one of them. But you think I'm going to sit here and watch these kids fight and there's no other adult around? No, I went out there and I put a stop to it. This is what community is. You cannot idly sit by and watch me suffer because I'm a sex worker. It is time for you all to be just as proactive in everyone's success, health, and growth as you are for your own.
Thank you, Tamika, for those powerful words. Something that we all need to hear to know that you and all sex workers are part of our community, and we need to show up for them and show up for their well-being, for their health, and for their safety. It's so critical, and that we need to address just this, again, as Ben mentioned, as you mentioned, the stigma that's out there. And so I want to now move into some of the questions that we've received. We've seen a number of questions about what exactly is the difference between decriminalization and legalization. This is something that we discussed in our report. And again, we found that there was really overwhelming support for decriminalization and specifically for full decriminalization of sex work. But I want to maybe pass this to Ben to kind of share a little bit more about what that difference is. And another kind of follow-up question was that we did have a few folks who showed some interest in legalization approaches. A lot of concerns about it as well. Maybe you can share some of what we found and kind of why you think we might have found some of that.
Thanks, Sean. So the decriminalization of sex work is essentially just the repeal of the criminal laws around sex work without passing further laws that regulates the sort of place and manner of how and when sex work is done. What we have found in the legalization jurisdictions, one of which is quite famously is about 6 counties in Nevada, is that you create and replicate tiered structures of sex work where there are sex workers who are most often white, most often cis, most often able-bodied, who are able to do sex work legally, and then you have an underground market of sex work that is sort of filled up with everyone who is not able to access the legal model. We also find that the legal model promulgates things like brothels that are something that our institutional stakeholders were particularly worried, in particular the ones who are victim services providers for children who have been victims of trafficking, that they are worried about the promulgation of corporate models of sex work. And so what we think is appropriate and what the sex workers recommend and asked for is the decriminalized model that gives them freedom to organize and gives them freedom to live and choose how they work. I think that answers your question, actually.
Absolutely, thank you, Ben. And Tamika, I want to also make sure you have a chance to share your thoughts, particularly about the difference.
I'm not for any other model outside of full decrim. You know, I'm part of a union of sex workers, and I get to talk with sex workers across this world. And even the sex workers that live under the partial legalization model are still suffering. There are some really weird effects that happen when clients are being criminalized and the sex worker is not. Number one effect is less ability to negotiate safer sex practices. That's a big no. We have worked hard over these last few decades to bring down STD and HIV and hepatitis C transmission through sex. That is an absolute no. Another strange effect of this is that the customer has all of the power in the situation now. So they're not offering to pay what they were before. That puts us in an economic bind. Whereas sex workers were able to do 1 to 2 dates per day, now they're doing 6 to 10 to make the same amount of money. That's a no-go. That's extra work. Then it puts the strange power into the hands of the buyer again to dictate what the location is that they do the sex work in. I don't want to go to anyone's else's house. I prefer to work from home. I feel safer in my space. And then sex workers are not having the same ability to report crime like they would normally. It's still not being taken as seriously because one side is criminalized, the other is still not. That's not a fair and balanced approach to this. You know, that's like saying liquor is legal to drink, but you can't buy it. Does that make sense? Why would I want them to put a law in place that is going to make it harder to do what I do, to complete my work, instead of just asking them to just take the barriers out of place. And then on that note of the legalization, where would I work? That would put another barrier in place for me as a transgender woman. I'm not a perfect example of a transgender woman, but I have a niche market that I work in. And there are other people that are in that niche market, people that are disabled. Are people going to throw all of these others under the bus just so they can be comfortable with sex work, when it is nothing but casual sex with an exchange? We are not punishing consenting adults for casual sex. You're punishing sex workers because they're getting something out of it other than the sex.
Great, thank you so much, Tamika. And I also just want to reiterate, in the report, we found similar concerns about the legalization model in terms of creating really a two-tiered kind of a system, whereby the most vulnerable individuals within our society, particularly trans individuals, as well as people living with HIV, might be pushed further to the margins. They might be outside of the kind of the legal system, in part because of, again, stigma that exists, and then a lot of concern around regulations that might require testing for HIV, or other approaches like that. So thank you so much for sharing that. We have about 8 minutes left, so I'm going to ask everyone to kind of keep their remarks to about a minute or two. We have a few questions that I think would be great for Rahana to jump in on before we kind of talk a little bit more about decrim and defund, because there seems to be a lot of interest in that as well. So Rahana, there are two questions. One is around, after decrim, housing is the most prioritized recommendation in the district. Could you talk about what accomplishing that recommendation would entail in a further gentrifying DC, where Black people in general are being pushed out? So that's one. And then similarly, I think not totally unrelated, is there still a negative perception of sex work in your district? Would sex work in public be decriminalized in a decriminalization model, or would that be covered by other statutes? And maybe that's not exactly a question for you, but maybe you have some thoughts on that just as an elected official. I'm sure these are types of concerns that folks may be bringing to you as an ANC chair, commissioner.
Yeah, absolutely. Thanks for that. So I think what underlies a lot of this, and a message that you've heard that everyone on this panel has said, is the goal here is to have sex workers participate in the community as valued members of the community. So I think that, a lot of folks are looking at this issue maybe for the first time and thinking, like, what comes first? Full decrim comes first, because sex workers can't, have that kind of community interaction without fear right now. There's a lot of sex work that takes place in my district, in my area, near Logan Circle. And, one of the other components at play here is that, some folks just don't want it happening near them in their neighborhood, so they call the police. That's doing harm to our community. That's doing harm to those sex workers. And so I think part of it too is giving folks an alternative. I was just participating this morning on a roundtable discussion at the DC Council on alternatives to policing for community needs. Folks need another number to call where they could reach another member of their community and, talk through that with them, not necessarily immediately dispatch people, because the sex workers might not be the problem. It might be that neighbor being concerned about something they don't need to be worried about because there's an education gap, right? So I think a lot of what decriminalizing is going to open the door for is more community dialogue, more community education, and more community support of each other, including of sex workers. And I forgot the first question that you asked. Oh, you're muted.
Sorry, the first question was about housing, and how housing is a primary recommendation from the report, and how do we, one, implement that, and what does it mean in gentrifying DC, where Black people are continuing to be displaced and where housing prices are increasing?
Yeah, so I think that affordable housing is a big thing that we need to tackle, and the ways that it's being addressed by the DC government right now are not sufficient. We see that in the, statistics and evidence in terms of the number of people that are being pushed out of their communities. And so much of this, of building the district and the city that we want to live in, is about strengthening community ties. And that means having resources and places for community members to stay in their community and not get pushed out. And so I think that we need more affordable housing for sure. We need less luxury housing. We have enough of it. And so I think that also it's very common in government and policymaking for, a bunch of folks who have researched this topic to sit in a room and come up with some solutions and then just, do them. And I think needs to be a crucial step of solving this problem to talk to our unhoused neighbors, to talk to folks that are in jeopardy of being pushed out. There are folks that are currently unhoused that don't feel comfortable going to shelters. Why not? We need to address those issues and make sure that they have access to housing that works for their lives and that meets their needs. So it's also about talking to those communities affected and trusting what they say. When they say, this is what I need to feel safe and to thrive in my community, the job of government and public officials should be to make that happen, right? And so that's kind of the perspective that I'm looking forward to bringing as a new ANC commissioner and as a community member who's interested in seeing, other members of our community be able to thrive.
Great, thank you so much. And so we have about 3 minutes, so I'm gonna just send out 2 questions. But before I do that, I wanna just say, in response to one question that we got from Penelope is, how are we gonna share our results of this research more widely? This is just the beginning. So we are planning to do some more webinars, which will be longer and get more into the report in the new year. So please look out for those. We will be sharing this as broadly as possible. So we'll be sending it to elected officials in DC, so ANC members, obviously members of the DC Council and others, sharing them with racial justice advocates, criminal justice advocates, housing advocates, and also just doing other types of community kind of dialogues to kind of get out the report and to make sure people are aware of the findings. So that will be coming. So please, look out for emails from the O'Neill Institute for Whitman-Walker, so sign up for our newsletters or our emails to get that information. So the last 2 kind of areas of questions have to do with kind of defunding the police. So when we think about defunding or abolishing the police, what does that mean for the future of sex work, decrim? How does the discussion we're having now kind of relate to these broader movements to divest from policing? And so that's one of the questions. And Tamika, maybe you want to take the stab at answering that. But then the other question that we received around, I have to make sure I get it right. Tamika, one more question. I just want to make sure I send the other question so we have a chance to answer it as well. Studies have shown that individuals who buy sex don't always distinguish between those who are exploited and those who are willingly engaging in sex work. How would fully decriminalization remove accountability for buyers who keep trafficking survivors? Sorry, make sure I rate it. How would full decriminalization and removing accountability for the buyers keep trafficking survivors safe? So this is a question particularly around, would full decrim, would that keep trafficking survivors safe? So those are the 2 questions, defund and around kind of trafficking. So Tamika, if you want to go first.
So if the police are not concentrating on tossing these gigantic nets out to capture all sex workers, they could actually hone in on those that are being trafficked. I mean, that makes sense because that budget that they're spending and not capturing the people is absolutely ridiculous. They need to be trying to hone those efforts in on who their real targets are instead of these huge nets. They did a trafficking operation at the beginning of this year. How many victims did they catch? You didn't hear about any because there weren't any. They were out there doing their typical sex worker stings. That's a waste of resources because a lot of those people ended up being no paper. And those operations cost a lot of money, a couple of $100,000 per operation, and they were doing them regularly. That's absolutely wasteful. Now, coupling that up with defunding, decarcerating this system, we need to start with decarceration. Decarceration in the sense of decriminalizing laws that do not add to public health, public safety, or public order. Sex work is not on that list. That should include drugs. Why are we penalizing people for drugs when that is a public health crisis? We should be trying to make their using safer, making sure that what they're consuming is safer. Same goes for sex work. Decriminalize it. It makes absolutely no sense. If it wasn't criminalized, we wouldn't have the prohibition problems that come with prohibition. Do we not remember what the prohibition of alcohol was like? There's a lot in history around it that suggests that prohibition causes criminality problems and a lot of violence. As soon as they stopped the prohibition, the violence went away. Same can be said about marijuana prohibition. When they decriminalized it and started legalizing it in some areas, not crazy about the legalization model because so many people that suffered for so many years because of marijuana did not get in on the new cash cow of marijuana. But when they decriminalized it, all of the laws that people were being arrested for, people stopped getting arrested for them. Crime rate went down significantly, particularly in Colorado. The numbers prove it. And the community got healthier. And they actually can fund their schools because they're not putting all that money into policing people smoking pot. The same effect can be had if we decriminalize what is loitering? Seriously, public intoxication. We sell alcohol, but you can't be publicly drunk. Come on. There's a difference between public intoxication and driving drunk. Let's have some clarity on what should be and what should not be. You cannot defund the police if you do not decarcerate the system. Those go hand in hand. And in all honesty, we need to reduce the police force by half because we don't need that many police. How many policing agencies do we need in DC? We're overrun with police here. We could reduce MPD by half and still get the same effect we have now. Because right now we are no safer with 4,500 officers than we would be with 22. And that money can be saved and used for other things that people actually want, need, and desire in this city. We want better education for our children. We want safer lighting on the streets for people at night. I would like to see parks and recreation fully funded. I would like for people to have real job opportunities. Give these people that are returning citizens jobs with the city. Those should be the first ones getting the opportunity. And people that are marginalized, like sex workers and drug users. Hell, no matter how much drugs I used in my lifetime, that did not stop me from doing my job. Y'all need to really think about what we're doing to people and what we should be doing for people.
Thank you.
I think I talked too much.
Thank you so much. We absolutely need to hear that voice, and we need to, that is really what's going to motivate us to have the change that we need in our community. So again, thank you to Tamika. I think that's the last word for this event. I want to thank you for joining us. I want to thank Rehana. I want to thank Ben, as well as thank Laura and Jeff who were on earlier. We've gone a little bit over, but I think you know that there's just so many issues that we weren't able to get to. I'm sorry if we weren't able to get to your question. Again, we will be doing further webinars and events in the new year, so please look out for those. We hope to continue the discussion. Please check out the report, which was in the chat feature, share it, and please feel free to reach out to folks at Whitman-Walker and the O'Neill Institute and at HIPS, particularly Ben and myself who wrote the report, if you have questions about the report. Again, thank you all for joining us today. Have a good rest of the evening and continue to fight, particularly on this day, International Day to End Violence Against Sex Workers. Thank you.
Thank you everybody for attending. I love you all.
Thank you.
Bye everybody. I love you guys. My cohorts.
Bye everyone.
Thanks everyone.